I'm going to be speaking about profuse bleeding, profuse hemorrhage, to use some more medical terms. To speak about it, I thought I would like to divide this concept and consideration into 4 age groups. First of all, the younger age group or the teenage years. If a young girl has heavy bleeding at this time, the mother gets very worried. And so what could be the reason for a young girl having heavy bleeding? The commonest reason would be a hormonal disorder. Generally, they would give us a history of having a missed period, maybe for a month, 2 months, 3 months, 6 months maybe. And when they have the bleeding, it's profuse and heavy. In these conditions, we do have to treat immediately the bleeding, cut down the amount of bleeding, but we also have to regularize the cycle. These girls have what we call polycystic ovaries. So yes, the doctor has to treat this condition because we can't have a young girl bleeding continuously, heavily, off and on like this. Secondly, the second group I would like to talk about is between about 25 to 35, the time when the girl can get married, get pregnant. So what is the possibility of having heavy bleeding at this point of time? Again, we have a few things to keep in mind. Whether the girl is pregnant or non-pregnant. In a non-pregnant condition, hormonal problems will definitely again be one of the commonest causes. Apart from that, there will be tumors. You have heard of fibroids, and then there is something called adenomyosis, where the lining of the uterus goes inside the muscle layer of the uterus. This also can cause heavy bleeding. And these are benign conditions, so you need not be scared of it, but they need to be diagnosed by the doctor. Apart from that, you can develop a bleeding disorder, bleeding or coagulation disorder. You could have a thyroid problem. Although strictly speaking, thyroid is a hormone, but I've considered it separately because on its own, thyroid disorders can cause heavy bleeding. Now, in the next part of the age groups, more than 40, if you have heavy bleeding, this definitely requires investigation, particularly if the lady is not bleeding regularly or having irregular bleeding off and on, heavy. We need to investigate further. It's very important to know what is happening before prescribing hormonal medication, because hormonal medication can hide a very deadly condition at this period of life, that is uterine cancer, endometrial cancer. So minimum what I would do for a lady above 40 who has heavy bleeding or irregular bleeding is to do ultrasound, of course, because ultrasound will pick up tumors, polyps. Polyps are this grape-like hanging of the lining of the uterus, and I would put in a camera inside and do what is called a hysteroscopy and take a biopsy of the lining, which is called a DNC, and this helps us to make a diagnosis and provide the treatment. So these are the various causes of profuse bleeding, profuse hemorrhage. I'm 40 years of age. It's very important we make a proper diagnosis and rule out endometrial cancer before starting medical treatment. Thank you. It's been lovely speaking.